start us off, we're going to look at hydrotherapy, and we have Dr. Christopher Morse, who's a reader in exercise physiology at Manchester Metropolitan University.
Hello. It's always strange to be in a room with people that pay attention. My students, I have 260 of them, they tend to just phase out after 5 minutes. I've got low expectations. So I work primarily with adults with muscular dystrophy. I've published work on diet, exercise, identified glucose intolerance in men with Becker's and Duchenne. And physical activity is a big part of that. I thought the questions earlier were really interesting. It's incredibly hard to be active. There's been so many initiatives to be active by the government, our government, the American government, and none of them have worked. We live in a society that is obese or overweight, and we spend, this is data that we've got from healthy individuals without Duchenne, 60% of our waking hours is spent being completely sedentary. And I want to reframe almost this idea of exercise. In individuals that can't exercise, breaking sedentary behavior may be more important. We know that accumulated sedentary time links to bone health, mental health, and heart health. And if we can break it, it can be beneficial. Data that we've collected from men with Duchenne muscular dystrophy show that their sedentary time is about 97%. So we almost have a window whereby we could actually do something and be physically active, be less sedentary. And that is easy for me to say, but it requires unpicking of societal behavior entirely, so we won't talk about that. The other tricky things that we have is that with Duchenne, your guys are probably told, oh, don't do as much. And there's a lack of guidance. We've seen this today. One of the things that Duchenne are doing amazingly is getting guidance out there. And the other thing is that most of us are inactive anyway. So expecting the boys with Duchenne to go, well, put it down and go outside is really difficult. So what can we do? The advice tends to be, this is actually from an Australian group, low impact exercise, avoid eccentric, which is lengthening in muscle activity, make it fun and interesting, and allow rest if needed. So one of the things I'm going to talk about is hydrotherapy. It's often seen, so hydrotherapy is low impact and advocated for people with MD. Hydrotherapy, for those, I didn't have to introduce this yesterday because there's a room full of physios and clinicians, but hydrotherapy is essentially exercise that's done in warm water. It usually needs very specific pools, and for boys with Duchenne, it absolutely needs specific pools that allow access and support and lifeguards and very warm temperatures. And the truth is, there aren't enough. The current evidence that we have to suggest that hydrotherapy is beneficial is based off a survey of 500 people with MD, adults, from MD UK, that suggested hydrotherapy can improve mobility, reduce pain, and enhance quality of life. But to advocate this to a healthcare professional, you need to be able to have evidence. It's what we've been talking about today. And in terms of evidence, and the highest form of that is randomized control trials, we've got 3. And I'll use the shorthand. So the Egyptian trial, 12 boys, aged 7 to 11, twice per week for 3 months, and they found no effect. The Russian study, as I'll term it, 28 boys, much younger, much more intense, 3 times a week for 4 months, improvements in walking speed, stair climb, floor rise. Okay, so intensity, volume, and age of the participants is key. And the only study in the UK that was done showed that hydrotherapy delivered in the UK is not feasible. Now, there was a magnificent switch on this. So what the authors did on this was they went back and said, well, why isn't it feasible? And as you can appreciate, recruitment's incredibly difficult to hydro, because if you recruit to hydro, you can't go on a drug trial. There's no pools for hydro. I'm not exaggerating, there's none. We had 1 available to us in the whole of the Northwest when we did our trial. And boys were negative about randomization. So basically, by partaking in this would stop him being eligible for another trial, because as great as this is, as a parent, you're always online seeing what NICE are going to approve. Take part in trials, guys. Ours as well. I think any patient wanting to participate in this trial would basically have wanted to be in the Hydro arm or not bother. And so if patients allocated to a control group, they just sack it off, okay? Making it impossible to do randomized controlled trials. Now, I'm very lucky. I work with a consultant in Preston, a guy called Christian Degoda. And he worked with me at the Neuromuscular Centre, a big advocate of physical activity, of health behaviours, and generally just being healthy boys. And we worked together. We put a bid into Duchenne UK, and they were kind enough to help us develop it, shape it, and do it. We had two incredible physiotherapists, Candice and Ellen, based at Oswestry and Preston. And we did a 12-week observation and 12 weeks of hydrotherapy. So that means that we don't need a control group. The boys were their own control. They did what they wanted for 12 weeks, normal behavior, and then did hydro. We measured quality of life, had functional measures, we did body composition, respiratory measures, we measured their diet, we measured their physical activity. Okay? We did as much as we could. And we did semi-structured interviews. Because after all of this counting, the thing that's important is the voice of the boys with the condition. Okay? Now, as you can appreciate, doing twice per week hydro isn't feasible in the UK. Doing it once shows no quantifiable benefit in slightly older boys. But, sorry, science idiot. This is the ambulatory score. From the first point to the second point is control, and from here to here is the hydro. If hydro worked, it would have plateaued or improved. These are the strengths. Elbow flexion, this one. Knee extension, hang on, that one. There to there, control, no change. There to there, worsens. Hydro, no different. Okay? I forget my audience sometimes, sorry. The interviews were much more compelling. We interviewed boys, parents, their assistants. Hydrotherapy provides significant psychological and sociological benefits for those with DMD, consistently improving mood, confidence, and emotional well-being while reducing anxiety. His confidence has rocketed. It was lovely to see. He always really looked forward to going to hydrotherapy. Now, there's no quantifiable benefit, but if my son said that, I want him to do it. He came back really happy. Parents described the sessions as fun, freeing, relaxing. They feel happier, more capable, and more independent. Felt lighter, happiest. This is a participant after doing hydro. They're more independent. They can do more in the water than on dry land. And it's more motivating than other forms of physio. And that's what we want. We want our boys to engage in the treatments. We want them to feel empowered. We want them to change their behavior so they can be more active. Socially, and you'll appreciate as your boys are becoming teenagers, hydrotherapy enhances communication and interpersonal confidence. It helps you feel more confident talking to different people. The physios explain how the boys who were initially shy became braver and more confident talking to them as the therapy went on. Amazing. It strengthened family bonds. We all would want that with our kids. Okay? Nice for us to spend time together, said one of the parents. Something to look forward to each week. Brilliant. So to summarise, I'll come back over here now. Hello. So with younger DMD, the Russian study, hydro was effective. It made the boys stronger, they were more capable, they were able to walk and climb stairs. That's how young they were. Twice per week in the UK, couldn't happen. Too many barriers. And barriers you faced, I'm sure. And once per week, which is what we did, showed no measurable or quantifiable benefit. But Hydro provided a rare space where those with DMD feel empowered, included, and emotionally enriched, with numerous subjective benefits. And that's what we really want. It doesn't need to be Hydro. It needs to be something fun, something active. You've got children that do their own thing. Hydro is too difficult. I'm sure there's something that would have the same effect. We saw the amazing video earlier of the dad stretching the boy, doing physio at home. That's active health behaviors that we're trying to encourage. Okay? Thank you. Now, next thing. I'm a terrible sports scientist. I end up doing sociology and psychology in health. We've got a study starting, funded again by Duchenne UK, incredibly, about mindfulness. And again, this is about an independent therapy for boys with the condition, men with the condition. So mindfulness is paying attention to the present moment without judgment, noticing thoughts, feelings, body sensations, rather than reacting to them or push them away. In other conditions, in spinal cord injury, we know that mindfulness can help manage stress, anxiety, depression, and pain. And anxiety is one of the things that these boys experience quite regularly. And instead of waiting for a goddamn drug trial, get involved in some health behavior research. I've got an incredible postdoctoral researcher, an actual psychologist, who's taking boys through daily mindfulness sessions. We need them to be over 14 years old, because they need to be able to understand the instructions. But other than that, there are no limits. Okay? So if you are interested, you can email Leanne or find me. I'll be loitering, and ask me if you want to get involved. Thank you very much.